Hello there, Cathy. My name's Alex, and I'm your nurse today. How are you going?
Alright.
Going all right. Now, I'm here with you today because my RN has told me that you are a type 1 diabetic, and that you, before you came into this facility today, you weren't too sure on how you're maintaining your condition. Which it's all right. Not everyone's too aware. I'm not here to shame you or anything. You wouldn't say that you're keeping up with it. No, it's alright. So yeah, my RN sent me in here today because she wants me to educate you a little bit on what happens with your condition, what goes on. And I thought, make it a bit easier. I made you a PowerPoint just so we can follow along a bit here. So I'll just scooch over a bit, right? So diabetes. It is a disease that negatively impacts the ways that your body makes use of blood sugar. So in your body produces sugar with your pancreas there. And in your case, since you're a type 1 diabetic, your pancreas doesn't produce insulin. Insulin's a hormone that basically keeps the level of sugar in your blood at a normal. So it doesn't send it too high or too low, because that's not good. But in your case, your pancreas doesn't produce enough of this hormone. So therefore, I know that they've told you that you have hyperglycemia, and I probably don't know what that means. It just means that there's a higher level of sugar in your blood than it should be. It's manageable. It's not bad. Right, so symptoms of your diabetes. So out of these symptoms, so you've got increased thirst, frequent urination, weight loss, fatigue, mood swings. Do you reckon you've experienced a few of them?
Yeah.
So risk factors are factors in a person that can affect their likelihood to get this disease. So I've just put a few there for you. So obesity, over the age of 35. Do you have a family history of diabetes? Do you know? Not sure. Yeah, you never know, do you? And then also not being physically active. So I've seen patients before they've developed diabetes because they've lost a leg, or and even bad diets. Sometimes people who do work where it doesn't actually require you to be physical, where you can just office jobs. Sometimes that can lead to diabetes too. So diabetes. So in your case, since you're a type 1, you have an injection of insulin. So remember that hormone I was saying to you before that your body doesn't produce? Yeah. So you get them in injections. And you can pretty much just you can have monitors as well, and the monitors hook up to your body, and they'll tell you if your blood sugars are too high or too low, and if they're irregular, as they say, you would take the injection and just jab yourself with it, because then you'd get your body the acceptable amount of insulin that you need to then regulate your blood sugar. There's two different types of diabetes, in case you didn't know as well. Type 2 just means that it's not insulin dependent like you are, and they can just treat it by eating healthier, but unfortunately not the case for you. But so recommendations that I'm going to say to you that you can help manage your condition. So getting yearly exams, physical examinations are the big one, because sometimes in diabetes they can lose function. Same with eyes. Eyes is another one. Staying up to date on your vaccinations too, that's another big one. Controlling your blood pressure is another big one, as well as taking care of your teeth. And I'm not sure if you smoke yourself, but I just put quit smoking, you might not smoke. I'm not sure on that one. That's it.